Earthquake, tsunami, or floods. Thousands of lives are lost each time any natural disaster strikes, and in the chaos that follows, many more perish due to lack of adequate and timely medical attention. The logistics of providing medical care to millions of pilgrims visiting Kumbh Mela is simply mind-boggling. And across the country, people residing in rural and remote areas have virtually no access to medicines or doctors. The problems of the rural poor are compounded by geography. Many villages are located in hilly terrain or in remote locations. Traveling poses a great challenge. The cost in terms of effort, time and money may deter people from seeking medical services from city doctors. In spite of dramatic strides in economic development, these problems are well known and are still a cause of worry to administrators. A comprehensive solution that has emerged in recent years is of telemedicine, coming across as a most challenging sector of e-governance. This will help people in the remote villages to avail specialized treatment on a cost-effective basis. The aim is to connect remote hospitals to the state-of-the-art hospitals located in cities. There is a provision of video conferencing where doctors can exchange ideas for proper diagnosis of patients.
Telemedicine would become a very, very good tool to get them to provide much better service. It can help them in providing training, continuously updating their knowledge. It can link them to doctors for more complex cases. Using video conferencing, voice communication and data communication, it is possible to definitely work out referral system and see that how the complex cases are to be handled. Telemedicine can also help in many other ways. For example, one should be able to build along with this a complete patient record system. One should be able to try to get to the rural medical practitioners whatever is happening anywhere else. Wherever necessary, one should be able to give access to the test labs to the rural medical practitioners. So the internet link between the health services in urban areas and that in rural areas can significantly bridge many of these gaps.
Countries like India, where the majority of the population lives in rural areas where healthcare facilities are inefficient and inadequate, tools like telemedicine can contribute substantially in bridging the gap between the demand and supply. Telemedicine involves utilizing the capabilities of Indian technologists to provide computer-based solutions for remote access of medical services.
Broadband communication link is finally reaching every village, and that is the pipe that becomes the basis to provide any services. After that, you have to build all kinds of tools and services. You have to build good video conferencing services, which fortunately exists. You have to build equipment which will monitor patients remotely, whether it is their temperature, blood pressure, their ECG, whether it measures their pulse, whether can we find their glucose measurement remotely. Making equipment like this at a very low cost, which can be put in the villages, which doctors can remotely monitor, would go a long way.
Reaching high quality government and social sector services like education, health, agricultural services to the remote and rural areas has always been a problem in the country. Partly because of the poor quality of physical infrastructure and the remoteness of these locations. To overcome these problems, under the National E-Governance Plan, 100,000 common service centers are being set up, which are broadband and internet enabled, and which have computing infrastructure with all the associated peripherals. In short, at these common service centers, all the physical infrastructure and connectivity needed for telemedicine is actually available. These centers are being implemented through a unique public-private partnership in a 3-tier model. At the village level, there is a village level entrepreneur who is responsible for running the center and who is a private individual and who forms the pivot around which the CSC system works.
In the East, we can witness successful pilot projects in West Bengal and Tripura. Among the western states, Gujarat has benefited from the telemedicine initiative undertaken after the Bhuj earthquake. In North India, telemedicine infrastructure has been set up in nodal hospitals in Himachal Pradesh and Punjab. And in the South, telemedicine centers are serving the masses in Kerala and Tamil Nadu at various centers. All these efforts, though commendable, may be best described as a drop in the ocean. There is an urgent need to scale up these efforts. While the potential of telemedicine is great, its impact has not really been felt in rural India. One reason is the awareness of the obvious risks involved in recovering investments. The need of the hour, therefore, is to keep patients only at lower hospitals where the disease is not that serious and the patient can be managed at that level. A case in point is a pilot project being carried out at IIT Kharagpur. The Ministry of Communications and IT supports this project, which covers the Institute of Tropical Disease at Howrah and caters to 2 hospitals in remote areas. Further, healthcare providers need to understand that though the technology is effective, there has to be continuous effort by both the government and the private sector to ensure the benefits of telemedicine reach the common man. Under the National E-Governance Plan, broadband connectivity at the village and block level will be provided. Common services centers will be points of gathering for the public as they will get their public services delivered here. Creating the infrastructure for telemedicine at these centers will allow provision of medical services for the rural poor at an unprecedented scale and bridge the gap between the haves and the have-nots in the field of medical care. This broadband infrastructure will allow telemedicine centers to be rolled out in the remotest corners of India.
While preparing for widespread delivery of telemedicine services, the CSCs could actually take a cue from the successful examples and models which already exist, and in fact not just replicate them but upscale them on a very large scale across the entire country, so that from a few pockets where such facilities are available, this actually becomes available quite ubiquitously throughout the country. As the common services centers infrastructure comes up, and now it is in an advanced stage, thought needs to be turned towards what else it takes to actually make the telemedicine services in the villages a reality. Linkages with hospitals, linkages with doctors, fixation of time and other logistical linkages for making the services available, training to the village level operator to be able to take the kind of readings and specifications that are required, providing any special peripherals which are required in the CSC for supporting telemedicine. All of these are areas which actually need to be worked on and developed. and all the arrangements need to be put in place so that the benefits of telemedicine and the benefits of qualified, competent medical advice in all the villages becomes a reality as the CSCs become operational in all the villages.
However, these challenges can be met through due diligence, effective coordination between stakeholders, and proactive creation of standards.
More than 55,000 teleconsultations during the last 9 years, given in almost 25 super specialties, and with the patient being located in suburban and rural India in about 30 centers, we are conclusively of the opinion that telemedicine in India has come to stay, and that today it is the only method by means of which secondary and tertiary medical expertise can be provided to the 700 million Indians living in the towns and villages who will never ever have access to tertiary medical consultation without this medium.
Telemedicine is a dream whose time has come. Telemedicine will usher a new light towards achieving the target of reaching out the benefits of IT at the grassroots level at much rapid pace. The issue is no longer of availability of technology. It exists, waiting to be embraced. What is required, though, is a strong will, change in mindset, and creative use of the technology.